We're live. Okay, it's loading now. I'll see. Hello, viewers. You are welcome to the second series of AICC Speaker Series. My name is Dr. Hadiza Osuji, and I am the Executive Director of AICC, African International Collaborative Center. And I'm also an adjunct professor at the New York University Silver School of Social Work. First of all, permit me to apologize. We had a little bit, we had some technical glitch. So you will not be seeing my face, but then most importantly, we're going to be seeing the speaker tonight, today. And our speaker with us today is no other than Zainabu Sesay-Harrell. And Zainabu Sesay-Harrell is a registered nurse. She is also the president of the Sierra Leone Nurses Association, New York chapter. Zainab Sesay, you are welcome.
Thank you so much.
Yeah. Zainabu is going to, of course, share being a nurse, a registered nurse, and for so many years. She's going to share with us her experience, working in the front lines during the COVID-19 pandemic. Not only that, she's going to speak to us about the challenges she faced while working, in the front lines, as well as how the stress, from the pandemic affected her relationship with her, with her family and her friends, how she coped, and also probably lessons learned, and will finally, provide suggestion for future consideration. So without, wasting more time, Zainabu, I am very happy to have you here with us. And I am going to hand, the floor over to you, and to just, say if you can speak to us and share with us your experience, as a nurse who has been working, in the field of nursing for a long time. Share with us your experience, during the COVID-19.
Good afternoon, everyone. My name is Zainabu Sesay-Harrell. Yes, thank you so much, Dr. Hadiza, for inviting me onto your show. Yes, my name is Zain, and I am a nurse. I am also an advanced practice nurse. I'm a nurse educator and a community health nurse. And I've been doing this for over 20 years now. I work a lot in community health. I work home care and also as a hospice nurse. And yes, I do see COVID patients. And with my background in healthcare and community health, I love to serve my community. I love to serve families, immigrant families. What I will say is I want everyone to understand that we are in a very tough time right now. With COVID. It's a really heart-wrenching disease that's affecting all our communities, whether we're here in America, here in New York, or even in Africa. And it's having a profound impact on everybody, on our work lives. The expectation is, there's a lot of fear, and people, are apprehensive and hesitant to go to work because there's not enough education. This is something very new to us. We're used to dealing with flu and a lot of other infectious diseases, which I'm very familiar with. But with this is really taking out our communities. So the expectation is, as a nurse, 20, 21 years, we're expected to go to work. Doctors, nurses, physician assistants, respiratory therapists, home health aides, CNAs, we're all expected to go to work. We commit ourselves to our community and our patients, but we're scared. We have lost a lot of nurses, clinicians in the field, social workers, respiratory therapists, a different kind of specialists. And just like you guys, even though we're providers, we are scared also. And so we're trying to use our expertise, the best practices, to make sure that we're being safe, we're keeping our community safe. But at the same token, it's, people have fear. And we're asking, just to make sure that people comply, they socially distance, they're washing their hands, using face masks. I'm asking the people of New York, sanitation practices, please work on them more. Try to clean up your streets, be more conscious to your environment. And as far as relationships with our family, this is very tough because a lot of us are very social people, as myself, very social. I'm in a lot of community groups, a social fellowship, my church, my family. I travel a lot back and forth from the Caribbean to Africa to here, to Europe, and planning to go to Asia. And it's put uh, it's put a cloud over everything because people have to be homebound now, and there's a lot of tension in communities. I have friends and family who, may live in apartments or smaller dwellings, or don't have people to go visit in other states, or they just didn't plan for this, and that we already have issues all over the world, depending on the country you're from, with food security and problems with sanitation and health practices. But to add this to it, it's a lot. And what I'm advising everyone is, just to pay attention to what's going on. Go with your gut feeling, read, um, listen to what they're saying, listen to your elected officials, see what side of the coin they're on, and also do what's best for you and your family.
Thank you, Zainabu. It is indeed a difficult, period.
Yeah.
And yeah, there was, a lot of fear all over the world. The world was basically confused, right? And with that in mind, actually, because I'm sure, working during this period, there were a lot of changes going on, because the pandemic just hit, and the next day there was just confusion. And normally, when you're sick, you look to the doctors and the nurse to take care of you, to provide, solution. But in this case, even I think at some point, the nurses and the doctors were a little bit confused. And there were a lot of policies, a lot of procedures, new changes coming in. So how were you able to, as a nurse, how were you able to cope with that? How stressful was that? And how were you able to cope with the day-to-day, changes going on, the procedures you have to go through? And, how did that impact you, really?
I mean, to be honest, it's very stressful. When, myself, when I have to go to work, you just, it's a lot of fear and unknown, because I'm constantly looking at the emails going on, everyday updates on COVID, and then looking at the emails coming from the mayor's office from New York City, and looking at, what new rule, whether it goes with testing, whether staff should go in a home, not go in a home, whether discussing testing and the issues with testing all over the city, the state, and the country, lack of testing, inaccurate testing. And, it feels like sometimes it's so much to keep up with. It's like, you're just looking. And I even think the people who are putting the data out, putting the emails out, themselves, they don't know. When I'm talking to people who work in healthcare like me, it's like, this is something that has left us speechless. And not too many things leave me speechless. I deal with, I have mentors who are scientists, mentors who are physician assistants, physicians, you know, nurses, advanced practice nurses, people who work in pathology. And we're all like, it's this virus that is like the flu, like SARS, impact like HIV. So it's like, what do you do with this monster? And, every time I see the emails, I know what it feels like. I know, I have so many friends and family who will admit to, they have gotten sick, whether they've been tested or not, whether it's fevers, nausea, vomiting, diarrhea, pink eye, rashes. And, I think even with my background as an African, a lot of my African remedies have saved me and others like me, because it's like, we have people who are asymptomatic who are passing away.
Yeah.
We have people who are very symptomatic, and then they become negative, and then we're hearing about people who become positive again. And and I talk to people overseas. I have friends in Asia who work in healthcare, and it's like, it's just this big question mark in the air. So I look at the emails, I look at the texts, I try not to panic myself. I know I need to stay calm for my own family. And I just look at what's out there, and I just try to take things day by day, be as safe as possible, you know, protect and cleanse and disinfect as much as possible, socially distance, encourage face mask use, the appropriate face mask, appropriate, you know, part of filtering on your mask. But, you know, this is something that it's, you know, as an expert, and I don't know if people would call me an expert, but I guess I'm an expert in my field. Um, this is one thing, it's really hard to advise. So, what we're doing is just advising people on the best practices for safety, what to do for safety, what to do for cleanliness, what to do for health, what to do if you have certain ailments, what to do if you seek care, what do you need to do if you're uninsured. I have a lot of people that, even though I'm a nurse, I was a health navigator at Lehman College. So I connected a lot of people to health insurance. And this is a time, if I'm asking people in the community, especially people of color, if you have other ailments, whether it's diabetes, heart conditions, autoimmune disease, we really need to make sure you're on top of your health, you're taking your medications, you're calling if you're feeling like you're having any symptoms. You're making sure you have emergency people around to contact in case something happens to you. But um, it's targeting everyone, young people, old people. I have friends who 40 who passed, I have people who 20 and 30 passed, older adults passed. Our vulnerable community, our young children who, even though they talk about a lower risk, they are at risk because, they can be asymptomatic. Older adults who are very high risk. And we just want to make sure that people are passing out as much important info to their communities, whatever language you speak, wherever you live in the country, wherever you live in the state, or even in the world. And just, it's time for us to make sure, and this is happening also, and we're having a lot of racial tension in the country, but we need to understand that it's a very important time for us to stay together as people, as whether it's the African community, immigrant community, our New York community, and make sure that we are all just making sure we're taking care of one another.
Right. Thank you. And I am just wondering, like when you get to leave home, each day, and I assume, you have, family back home, it could be kids,
Yeah.
significant others. Now,
Yes.
what impact, do you think this had on them? How, what was like the scenario kind of like when you leave to go to work in the morning and when you're coming back at home? For instance, in one of the support groups, we had, or we're having actually, because it's still running, we have it twice. Oh, you're part of the support group. And one of the nurses has shared that, before she gets home, she get a call her home and make sure, her kids leave the living room. They know they all go back to their room. And so that when she gets to her house, she takes off her shoes from the door and then she takes a shower, disinfect herself and everything before she will now, I mean, hugging is out of the question. Before she now comes to the living room and just have a brief discussion and, she then gets to say good night, and that really put a little bit of strain on the relationship. But then, that is what she needed to do. And in your sort of scenario, and how was it like?
Very similar.
Oh,
When things started happening in like end of March, uh, and I was going to work, I mean, it was scary because I have young children, and I would come home from work, have a routine that I call my children, call my mom who was watching them, have a routine where they would open the door for me, leave it ajar. I would shower in another part of the house, leave all my dirty clothes in a certain part of my house, my shoes, my uniform, my badge, everything. Disinfect everything, spray everything down with a disinfectant that I buy that kills, all HIV, all kinds of hepatitis, all kinds of infectious diseases, and coronavirus. Spray down my devices, spray down my bags, everything. Spray my car down, and then wash, and then go to my kids. So by the time I get up to my children, it's 35 minutes of my process. 35 minutes to disinfect, scrub myself down, wash my hair every time I come from work. Every time, whatever's in my hair, I wash it. And the info that I was getting from my friends overseas who work in healthcare, I mean, because leaving anything exposed had you at a risk, and they were absolutely right. They were absolutely right. And then come to my kids. And it was hard because if you have a small child who's running to you, who wants to give you a hug, but you're pushing them back because you have uniform on that was touched, patients in the community is touching it. I mean, it's heartbreaking. It's heartbreaking every day. And it's heartbreaking to go to homes where you find people and, they tell you they had no symptoms. And then you show up there and they're having fevers, coughing, and everything. And you just worry, I have friends who did that and were having the severe symptoms of coronavirus and would have to quarantine in their basement and not see their family for a week or two after coming home from work, or coming home from work, got sick, and now has to stay in their basement for over 2 weeks till they got better.
yeah.
Very hard. It's this spring, end of winter, spring was a very hard time for all of us. And we understand that flu season is coming up. The peak of flu season usually happens January, February. We start normally, encouraging people to get their flu vaccines by, September. And that's coming. We have flu season coming on top of COVID in the air,
Yeah,
in all our surroundings. And so
yeah.
it's,
No,
I'm just asking everybody to pray and just, be silent, and whatever you were doing for the past 4 or 5 months for survival, you need to continue those practices. Your vitamins, staying mentally healthy, physically healthy, eating a balanced diet, staying positive, talking about good things, emitting good energy around you, surroundings. Your whatever remedies you were doing, whether it's old back home remedies, but if it's working, fine, you know. But we're in the long haul for
mm-hmm.
this.
Yeah,
So these conversations and these type of, having events on Facebook and Instagram and YouTube and all of this, even though we all can't sit physically in a room, it's very important that we have to continuously have these conversations to do. This is, virtual community outreach. And I thank you for this platform.
I thank you too, for participating. So, and you had mentioned pray. You were advising that we should pray. So, thinking back, thinking around that, um, how were you able to cope to deal with all of this? The stress, family, work. How were you able to cope?
Lots of prayer. I am, especially when I go in the field, I am that nurse known for, I pray with my patients' families. Um, you know, I share my own experiences and testimonies, but I know that I have been through some things in my life personally with, health with either my child or things in the environment or levels of hardship, and I know what has pulled me through. And so this is a time where, we really, I say it all the time, we really need to seek God because I feel like He's the only one who could stop it. And we pray for all these scientists and all these people who work in these labs, and all these people who work. Pray for the CDC, and pray for all these people who work to help reduce uh, the deaths, and figure out what is really going on with this disease, and this virus. And I pray, pray for our president, no matter what's going on, pray for him to make sound and right decisions for us, for our people, for our community. Pray for our elected officials, because this is something that has rocked every community.
Yeah.
uh, every community.
Yeah.
It's rock elected officials. If they're not telling you, they have relatives who died, or friends and families. We have people that we look up to, whether it's your pastor or your imam or whoever. It's affecting everybody, teachers and principals and people in healthcare and community services, and our homeless community, and our bedbound, our homebound community, and our international community, our undocumented community, which is another big one, who
Yeah.
doesn't have access to services,
Mm.
access to healthcare, access to food, not getting stimulus packages. We have to remember everyone in this time.
Yeah.
Everyone.
You're absolutely right. Thank you for sharing that. And just also wondering, and how do you think your kids were too young to understand you know, what was going on or what is still going on? How did they cope actually?
Now, I'm sorry, I missed that part. My children, you said?
Yes, I mean, you know, you're
Um,
talking about how you cope. Now, do your kids understand what is going on or what went down, and how do you think they were able to cope to deal with, you know, the situation? And also having a mom who is a nurse working at the front line.
well,
How were they able to cope with that?
it was in the beginning. It was hard for my children. They didn't understand what was going on. They didn't understand why we didn't go to school anymore. They didn't understand why we had to stay home. My older two children, they started to understand a little bit, but my younger one, he didn't understand. Like, why do we have to stay home? And then, I try not to watch the news so much. I just watch it, on my phone to myself. My mom would watch it to herself, but it was hard. And then they all understood the severity of it, because like they noticed week after week we weren't going to school. They already know mommy works in healthcare. They already know I'm trying to be on top of our hygiene and different things like that, and our cleanliness at home. But when and they saw grandma doing it also. But it was hard. But now kids were understanding that this may be our new way of life.
Hmm.
And so my kids are willing to um, comply and do the things that I need them to do to be safe, as long as I'm leading by example. And also, at the same token, I'm trying to do everything in my power so these kids can live, and so they don't feel um, isolated, and try to still keep them engaged with their friends and go on little short trips locally. But it's very hard for kids right now. And, the parents who are at home with these children and homeschooling, and, you know, um, it's a lot, because now I have to become not only a mom, work in healthcare as a nurse, in the community, but also become a teacher. And at home 5 days a week, and it became taxing. It became by week 3, I thought I was going to lose my cool, but now I understand. We understand this is, this is what it is now, and we're going to have to adjust. And you have countries and communities. We all are going to have to learn to adjust. And if you're doing something that works great for you and your family, share it with a friend. Um, and even if it doesn't maybe apply to them, or maybe they can take something from your situation and make it applicable, apply to their own life, and use it. I have friends who call me 2 in the morning, 5 in the morning, 4 in the morning, and if I know they're calling for that, it's something that they need. It's very hard right now for people to be at home with their parents, people to be at home with their kids, people to be at home alone, and we need these social skills. So if you're missing your friend, pick up a phone and call them. If you're missing, it's okay to check on people to see if they're okay. I tell people that all the time. It's like, it's all right to pick up a phone and just see if they're okay, if you need anything. Shout out to all the doctors and the nurse practitioners and providers and PAs who are doing, enormous amount of telehealth right now, and, counselors and caseworkers. It's not easy for the people who are going into work. It's not easy, but, for the parents with their kids, I feel your pain. I understand. But let's let's we all have to just how to figure this out together. Especially you have schools and communities now passing out food, fresh food, pantries. People willing to get you school supplies, give you gift cards so you can keep your kids engaged with activities in school and things that you need. It's a lot, and, it's almost, we could be on here all day talking about it, but I just want everybody to know, whatever you are doing your best.
Yes, absolutely, absolutely. And we just have to just keep trying to do our best. Yes. And Zainab, what advice would you give your hospital or any hospital that maybe works, even healthcare providers? What advice would you give them that would have better handled the pandemic?
What advice would I give them is, because we know these entities are going to make their decisions regardless of what we think. They pass out surveys, they want to feel how we feel. And I know the thing is, people are worried about employee retention because people are leaving, people are taking unemployment, people are not going back to work, people are scared, people have died. And so, what I would just advise is people just be understanding to people's situations and be present and be empathetic, and see what your employees need, be as transparent as possible, and be honest with them and let them know, what you guys are able to do and provide and what you're not. And what alternatives can we do to make your work situation better for you? Because the thing is, it's like a time like this, we want people to feel okay going to work. I don't want people working in a crisis and feeling miserable going to work, or especially, I have people who are working from home, and they're it's it's like, everything that they were going through when they were going to work, now it's times 20, and they're at home in their own home environment. So the thing is, we want people to understand, like, these are people that you're dealing with, these large institutions. We want you to understand that this is somebody's mother, this is somebody's father, brother, sister, somebody's child, aunt, uncle, niece, and just be willing to understand, and just to make their work environment and their mental health much more better.
Got it. Thank you. And just before we round up, how has this pandemic changed you?
How has the pandemic changed me?
Yes.
I appreciate life more.
Yeah.
Yep. I appreciate life a lot
Right.
more. I realized that even before the pandemic, I knew that I don't, tomorrow's not promised.
Yes.
But know with how it is now, everybody will agree 2020 um, was a year and it's not over. It's only August.
Yeah.
Um, we still have September, October, November, December, 4 more months.
Mm-hmm.
And then we have 2021. But this is a year where we all learned, like you learned about yourself being homebound or on quarantine. You learned about, what you can tolerate and what you can't. And um, maybe certain time to make changes with your life, whether it's your career, your finances, your family. People need to not forget about that. You need to remember about your future, your finances, what to do with your kids, the future of, maybe after all this, people realize that they don't want to be in the situation that they're in anymore, whether it's living environment, work environment, relationships, and so now it's time to really, people need to focus on the things that are important and just thank God for life.
Mm. Absolutely. Absolutely. And finally, Zainab, um, thinking back, right? Probably from the lessons learned. Any suggestion for future consideration? Like, do you think we are now better to handle for some unforeseen, situation like this in the future? By the grace of God, hopefully nothing like this ever happens again. But when we look at the rearview mirror and look at the Spanish flu, the previous pandemic, now with this and from the lessons learned, would you say, we are prepared or we're still a work in progress?
Um, the lessons learned, I think I would use the word I would use for that entire question is preparation.
Yeah.
We need to learn to be more prepared. Um, everybody. And I know this, this is targeting the African community, but I need the African community to wake up
Okay.
and understand that, this is how this world runs. And, we are in America or even in the diaspora, whether you're in Europe, Asia, whatever, everything affects, it's like a domino effect. So whatever we're doing here affects people back home.
Mm-hmm.
And whatever's going on back home affects people here. And we just need to learn to be more prepared. We have to be more prepared.
Yeah.
Um, um, so if things happen, you may have people after this whole thing say, "Oh, I don't want to be here anymore. I want to go back to Sierra Leone. I want to go back to Nigeria." Did you prepare for those things?
Mm.
You know,
Good
people look
question.
at retirement. I talk about that a lot.
Yeah.
Finances, investment, investing in certain activities. So in case these things happen, are we prepared?
Mm.
And that's what we need to teach our kids: preparation and independence.
Okay. Thank you. Thank you. Thank you. Well, viewers, Zainab, I can't thank you enough. I appreciate you joining us today. And what can I say? You have said it all. So, yeah, it was the pandemic period was a humbling period. It was a challenge. Well, we're still, in it. So, it's a challenging period and it's, post the crisis. It's, it's really, people are still in fear. People are still, trying to adjust. We're still, going through the healing process. And I am assuming some of the African remedies Zainab mentioned was helpful. She
Mm-hmm.
had mentioned, prayer has, really, I think people were sort of turning back, realizing really the importance of, being close to God because everybody I spoke to really talked about how prayer, played a very vital role in coping with the situation. And also, well, like you had mentioned, Zainab, this may be a new way of life for now. And, and the quicker we learn to adjust, would really be helpful for our mental well-being and also for, our moving forward in life. And also you had, provided suggestion for other, hospitals and, healthcare professionals in the sense that they should be more understanding. They should try to be open and transparent, letting, in terms of workers, retention, letting them know, what you can offer and what, you can offer and how you can make it work. And also being sympathetic and, and being there and being flexible. So these are all, important, pointers you have mentioned. And I'm sure it will go a long way in helping, it's helping me as I'm talking to you. I'm sure it will go a long way in helping, others as they listen to you. So I thank you. And so viewers, we have, heard, from the lens of a nurse, a registered nurse who has been working in the field for a long time. Stay tuned September 5th for our next week. That is next week, Saturday, for our next series where we're going to have, another speaker to talk about, really their lived experience in dealing with bereavement. So I am looking forward to that time. Zainab again, thank you so much. And
Thank you.
goodbye. Bye, everybody.